Hello, hello. This is a pre-placement reflection. My first reflection, so we're going to have a play around and see how this goes. I wanted to kind of get on screen and have a bit of a waffle before I go on placement with Jo in private practice for long-term health conditions. Jo gifted me the opportunity to attend some sessions that she's co-running for the Hypermobility Syndromes Association. So I attended the mental health session a couple of days ago, which was co-facilitated by herself and a colleague of hers called Kim, who is a hypnotherapist and a solution-focused therapist as well. So I just wanted to talk about some of the kind of take-homes that I had from that hour-long session. So I think what stuck out for me was when Jo used an example of her adapting an activity, such as seeing her friends, which was, a social activity. And she was saying about more often than not, what her body is capable of doing is sitting on the sofa in her pajamas and eating some pizza. And her friends come over and they all join in, and it's great. And it sounds wonderful. And what struck me about this, seemingly simple anecdote, was the absolute beautiful acceptance of what the body is doing and where it's at. So not trying to force it into a societal norm. And that led me on having some deeper reflections about disability. So I have my own disability. I'm registered as severely sight impaired. I've had this disability from birth. And my personal experience with disability is that I've absolutely experienced internalized ableism. I think when I was younger, I definitely, I'm nearing on saying maybe even an addiction to overproductivity. I worked myself extremely hard, and I compared myself to fully sighted people, which is an absolute recipe for burnout. And then I trained as a psychotherapist and had lots of therapy, and started joining some dots together. It's like, oh, okay. But the internalized ableism occurs. Even this week, I think in my current job in social services, I can't drive because of the visual impairment, and I needed to go and sort some equipment or pick up some equipment or whatever, but the equipment store is quite a few miles away with not great public transport links, and of course I can't carry a bigger piece of equipment on public transport. Um, and I was, the inner critic came out, and I was berating myself, and I was feeling really like, oh, you're rubbish, and why can't you do this? Because again, I was trying to fit myself into some societal norms of, all occupational therapists drive and their specialisms are equipment, and if you're not doing that, or if you maybe need to do things in a different way, then shame on you, Jordan. I wouldn't speak to anyone else like that, but it's just being aware of those things crop up within inside myself. And I'm inclined to say that I think that is a likely common thing that comes up with many of us whom experience disability. So I found Jo's anecdote absolutely beautiful in a practical sense, but also in the pure acceptance of this is me, and this is how it goes, and this is what I can do, and this is what I can't do, and this is how we're going to make the most of that. I thought it was really beautiful, and it made me reflect on being kinder to myself. And there was a real permission giving, of this is where we're at, and I thought that was really cool. And I think often with ourselves and with our clients, with the beautiful people that we get the opportunity to work with, there's a lot of that, allowing yourself to notice that things are different and allowing adaptations to be made because of that. So there's a bit of acceptance that needs to happen. There's a noticing, and then there's an acceptance, and then there can be an adaptation, whether that's a very physical one or whether that's how we do an activity differently or something, so that we can do what's important to us. So that's really cool. And then I got a little bit deeper as well. I was reading some, there's a clinical psychologist called Martin Seeger, and he wrote about the 5 core psychological needs. So if we think about Maslow's hierarchy of needs, it's a little bit like an extension of that. But what he says is if we don't have one of these needs, then we start getting into a bit of trouble, and our mental health can suffer because of it. So I'm just going to read them out. They're on my phone. So they are: to be loved, which is attachment; to be heard, which is empathy; to belong, which is identity, home, family, however we conceptualize that; and to achieve, and that's getting a sense of fulfillment; and then also to have belief in something and hope for the future, and that can offer us meaning. And as I was reading those and thinking about those, I was thinking about belonging. And we're social creatures, and we need to belong. We need to belong to survive. It's quite a primal thing. So we have that need. I think with disability, what it does is, I notice in myself that it puts me, outside. Sometimes I feel like I don't belong because I have to do things differently, and that can really, ebb on my, I suppose, sense of survival from a really like core place as well. So I think maybe, that's where the loud inner critic comes from. And yeah, I wonder how other people experience that as well. So a bit of deep diving into some psychology theory there, and yeah, a reflection of how that session actually gave me some things to think about in terms of the hypermobility, and I'm looking forward to what's to come.